You know, our border communities are still seeing major spikes in COVID cases right now. Yuma County, a hot spot now for a second time. So I actually went down to Yuma to see firsthand how the county's only hospital there is dealing with this second surge of coronavirus cases. It's an inside look you're only going to get here on ABC 15. Yuma County is home to more than 213,000 Arizonans, and Yuma Regional Medical Center is the place they come to for care. But right now, the hospital is being overwhelmed with patients.
As a whole, it's been really tough to see what the patients have had to go through.
Nurses Sarah Thompson and Morgan Hodges have worked in the emergency department for years. It's getting the brunt of this new wave, and patients could wait 10 hours to be seen.
The toughest days are, of course, days that we lose patients, but close second are days that we are so busy to where we have 20-30 people waiting in the waiting room, but we're also getting EMS and paramedic traffic nonstop. So we're tight on rooms and we have really sick patients, and every time we try to bring a patient from the front, a new one comes in.
The staff here getting little rest after the summer surge of COVID before things started ticking up again. The county is experiencing the highest rate of spread across the state, along with Santa Cruz County. As of Wednesday, the percent positive of COVID test was 17.5%, compared to Maricopa County at 11.8% and Pima County at 9.4%, both places with more than 5 times the population. And it's taking its toll.
It's hard because, I mean, it's hard for us here.
Yeah. What's the hardest part?
Having to see these patients. They're here very sick and without their families.
Zamira Hernandez knows all too well, working in the hospital's packed COVID unit. Due to an influx of COVID-19 patients, the hospital had to open a second COVID unit located behind this door. And we got an inside look, but first we had to gear up. Anyone who goes in has to have a gown, gloves, and 2 masks, and if treating patients, a face shield as well. When I asked about capacity, the answer wasn't about beds, it was about personnel. They have the rooms, but just not enough nurses to staff them. Even YRMC CEO Dr. Robert Trenchel admits the situation has gotten dire and says this is unsustainable.
If our projections hold true, it's going to be a very difficult, slog here in terms of what's going to occur. So we need that nursing staff.
Staff all over the country fatigued, posting videos and messages expressing frustration, like Dr. Cleavon Gilman, a doctor contracted to help at YRMC, whose post about there being no more ICU beds went viral, as did news that he had been fired. Dr. Trenchel says it was a misunderstanding.
By no means do we want to, stop people from expressing what they're saying. We encourage that, in fact. But we need to not sow panic in the community. We need to make sure the community knows the accurate situation that we're in right now, and that's what we do.
When broken down by zip code, Yuma County had the top 2 or top 3 worst areas every day last week. But there is good news on the horizon with the vaccine. It should be here in a few short weeks, and it can't come soon enough for all those still tirelessly fighting on the front lines.
Our staff is an amazing team of people. They're working hard every single day. We're going to continue to support that because we're not going to lose sight of keeping the patient our center focus of everything that we do, and we're going to get through this together.
So all of the nurses I spoke to say they are worried about the upcoming Christmas and New Year's holiday. They say their one wish is for everyone to stay home and stay safe. And I want to give another thanks to those nurses that we were able to speak with and all of our frontline workers right now who've just been working so hard.